and welcome to the Texas Talks podcast. I'm your host, Brad Swail. Today, I have the pleasure of speaking with Representative Gary VanDeaver, who is serving his sixth term as the state representative for Texas House District 1 for Bowie, Cass, Lamar, Morris, and Red River counties. He is the chair of the House Committee on Human Health, as well as serving member on the House Committee for Higher Education. Representative VanDeaver, how are you?
Doing well.
Good. It's a pleasure to speak with you.
Great. Thank you. Pleasure to be here.
Well, thank you so much. We're recording on Tuesday, August 26th, so pretty early in the morning, so I appreciate you taking the time out of your busy schedule. I know the special session can get a little bit wild.
For sure.
So it's great to speak with you. That intro was pretty basic. Would you like to add anything to that?
Well, most of my background is in education. I don't know if most of your listeners know that, but I'm a 33-year retired educator before I ran for office. So that's really where I come from, and a lot of my policy decisions and policy positions actually come from my background in education. I'm also from rural Texas, and I own a cattle operation, and so the agricultural side of it also. So just a couple of background items of interest, about me that kind of help people understand why I believe what I believe and why I take the positions I take.
Absolutely. So you were you said you spent 33 years in education. Correct. Was that as a teacher?
I spent 10 as a teacher, and then I went to I was an elementary principal, high school principal, and then superintendent.
Okay, great. Wow. So you moved up, and now you're state representative. Look at you.
Yeah.
Always on the rise. So I'm glad that you gave a little bit of that background, especially the rural part, because some of what I want to talk to you about is what's going on in rural communities, especially your districts. And I think it was the regular session, HB 18 was passed, the Rural Health Stabilization and Innovation Act. Can you tell me a little bit more about that and why it's important?
Yeah, we realize that healthcare in rural Texas is something that is not what it should be, not what we all hope it would be. And so House Bill 18 was really an effort to kind of shore up the rural hospitals and just rural healthcare in general. The bill provides for rural hospitals to be able to apply for grants and receive funding to help in operations and then also just delivery of services to those rural communities. We continue to see rural hospitals close across the state of Texas. I've experienced that in my district, in my home county of Red River. There is no hospital anymore. There used to be a fairly large 3-story building, that was the county hospital, and it closed some time ago. So, the citizens of Red River County now have to drive 30, 40 miles minimum to see a doctor and to receive health care. And that's not unusual in rural Texas. Actually, there are people who have to drive 100 miles to receive health care. And this is in the United States. This is in Texas. And so I think most of us would find that to be unacceptable. And so that's what we're trying to do with the Rural Health Care Initiative. And I want to just kind of give a plug to Speaker Burrows. When he first called me in to talk about chairing the Public Health Committee, we talked about rural health care. Of course, he is from West Texas, and they're experiencing pretty much the same thing in West Texas as we are in East Texas. And so we began working on this initiative and was proud to get it across the finish line.
Yeah, I guess I'd like to dive a little bit deeper into that. I mean, growing up in Austin, obviously there's multiple hospitals, and I don't know that I've ever heard of a hospital closing in Austin. I've heard of hospitals being built, and I'm sure that's very similar experience to other people that live in the urban centers here in Texas. In your case, the hospital closing, people having to drive 30, 40 miles, in other counties, maybe 100 miles for healthcare. I guess being a city boy, it's hard to imagine what that's like. Why is that, like in your case, in your district or in your county, home county, why did that hospital close? What happened?
Well, just the challenges that we're facing in rural Texas in general. Population is decreasing for the most part. People are leaving rural Texas and moving to the cities, and where they do have better services and better opportunities. And so just the reduction in population, and then the challenges of being able to charge enough. The hospitals, reimbursement and rates. And so, there are a lot of challenges to those rural hospitals. And then attracting doctors out to rural Texas. Doctors go to medical school and spend all that time in training. For the most part, they are in a urban area when they're doing their residencies. They like the amenities, and so the thought of moving out to rural Texas is just not something that's inviting to them. And so, and that's one thing we've done to try to enhance rural healthcare is try to have more residencies in rural Texas. We found that when prospective doctors come to rural Texas and do their residencies, they realize they like rural Texas. They like the slower pace and getting to know their patients on a one-to-one basis and all the things that go with being in rural Texas. And so, those are efforts also to try to draw professionals to the rural areas.
Yeah. Are there other ways to attract? I mean, that's a great idea. I think probably I've been to rural Texas, and there is certainly, I don't know if it's just me, but I often wouldn't it be nice to go live out where there's not so many people and have a little bit more land, and it is a little bit slower, and there's something appealing about that. So I could imagine a doctor doing their residency finding that appeal. Is there other ways, like, I don't know, maybe this is just on the private hospital side, but do doctors need to be paid more to sort of attract them to those areas?
We think so. I think so. And again, that's part of what we're trying to do is enhance the opportunities for increased pay, at least increase above what it is today. It may not. I don't know that we can necessarily compete with the urban centers just because of the patient load that they see and just the income they bring to the hospital. It's just hard to match that in rural Texas, but certainly, financial incentives to get these doctors to rural Texas, I think, is an important piece of it. And also, I think one thing that maybe prospective doctors don't take into consideration is the lower cost of living in rural Texas. You're making a little less money, but look at your standard of living for the same amount of money. In rural Texas. For what you can buy, rent an efficiency apartment in the city for, you can buy a 3-bedroom home in rural Texas.
And that 3-bedroom home probably sits on an acre or two,
exactly.
Or it's that there's a cost benefit analysis that maybe people aren't quite thinking super thoroughly through.
Right.
Does telemedicine play a role in all of this? I know that was obviously popular with COVID, and you're describing people driving to the county hospital 30, 40 miles or whatever for healthcare, but when I think of healthcare, I don't necessarily think of going to the hospital.
Right. Yeah. Telemedicine is certainly an important piece of this as well. And again, that's one of the reasons it's been so important that we get the broadband in rural Texas, because what we've learned in COVID was that we have these services available for education and for healthcare, but we didn't have the connectivity to people's homes. And so people were having to drive to McDonald's to hop on their Wi-Fi to do their schoolwork,
Sure.
And so, again, as you peel back the layers, you find another layer, it seems, of challenges to rural Texas. But yes, rural telemedicine is something that's very important, and it does provide rural Texans with a real opportunity to have their visit with their doctor without having to travel, and that's very important. But we know that there are times when it's necessary to go and actually have a doctor put their hands on you and to diagnose your issues, or
Sure.
go and receive some kind of treatment or some kind of procedure. And it's not that easy to even deliver a baby anymore in rural Texas, and so just the very basics.
It's not that easy to deliver a baby in rural Texas. Yeah, I guess I'm a father of 3. If we had to drive, I don't know, 50 to 100 miles to get that baby delivered, unless it was a planned C-section, that would be a real challenge. How do people overcome that?
Yeah, and to be honest with you, there are some that just don't make it to the hospital.
Sure.
They're born, in
the back of the car.
In the back of the car,
right?
But and I think I have 2 daughters, and for both of them, we lived about I guess about 40 miles from the hospital, so we had about a 40-mile drive for their delivery, and we were just very cognizant of the signs, and if it looked like it might be time, we made a couple of false runs,
Sure.
but we wanted to be sure we were there when the time came.
Yeah, maybe there needs to be some sort of provision in the law that if you're driving more than 50 miles to deliver a baby, it's okay to speed.
I think so. I think most prospective fathers will speed anyway, whether it's legal or not, in that situation.
So let's talk a little bit about the opioid crisis. You served on the Select Committee on Opioid and Substance Abuse from 2017 to 18. I feel like the opioid crisis got a lot of news coverage. I mean, I don't know, between sort of that time frame, 17, 18 to maybe about a year ago, and I don't see a whole lot about it now. Maybe I'm just browsing past it, but how is the opioid crisis going as far as rural Texas?
I think what came out of that opioid committee, the study that we did, the commission, I think we saw some really good policy come out of that commission, and we recognized that overprescription, doctor shopping, those kind of things that were going on, and a person being able to go to 4 different doctors within the week and get prescriptions from each one, and so we had some policy changes so that there's better tracking of who is prescribing and who's getting the prescriptions, better methods of disposing of opioids that have not been used, prescribed but not used, just general education of the public and of the medical world of the dangers and some things to prevent opioid overdose and overprescription. So I think that was a very positive thing, for us policy-wise. And I guess like most things, over time it does kind of slip off the front page and
Sure.
it kind of finds itself, farther back. But I do think what we did then has had an impact. I haven't seen studies. I don't know. That's something that I probably need to go find. There's some recent studies on the opioid addiction and opioid problem. But it just seems to me that we don't have some of the same problems we used to have. We may have different problems with opioids, but I think we took care of some of it.
Yeah, for sure. I mean, I know that it has been. I know it still exists. I don't mean to sound as if it's not present. Especially, I mean, whether it's an urban or a rural community. I know that there are still overdoses, accidental overdoses. I know that. I even read a story, I think last week, that parents are sending their kids to college with I think they called it like a college prep kit, which included the what's the medicine? I'm blanking on the name that stops the overdose happening. Naloxone? No, is that right?
Naloxone, I think, or
Narcan.
Narcan.
There we go.
There you go.
Narcan. So I know that people are still worried about it, and it still happens. So is this? I mean, do you think that the way that the current administration on the federal level is, handling the border and handling that sort of crisis, do you think that is maybe playing a role in helping with the opioid crisis?
Oh, I think so. I think anytime you can kind of close off what's coming into the country, at least what's coming in unrecognized or undetected, I think that has to be helpful. So yeah, I think the activity at the border has been very helpful in controlling the illicit drugs that are coming in, and ultimately that keeps drugs off the street.
Yeah, absolutely. In this past session, you did pass HB 4783, and you were the House sponsor of SB 1986, which I don't think passed. I think it got sort of held up in the calendars committee. So there's still work being done. Right. So there's still plenty to do, I'm sure, and stop. It could always come back. Is that a fear?
I think so. Yeah. I mean, the people who are profiting from these drugs are very creative in the ways they find to get them in the hands of people, and many times it's in the hands of young people. Yeah. And so, I think if we're not vigilant and not really paying attention, then yes. And there's it kind of as far as the test strips and everything, that kind of becomes political, and I think that's what I saw with the bills we had.
Okay.
I think some view having test strips as giving people the freedom to use drugs, illegal drugs. I see it as an opportunity for people who are going to use illegal drugs anyway to know if what they're taking is going to kill them.
Yeah.
And so, I think hopefully we can come to a point where we can put the tools in the people's hands that will keep them alive until they can kick the habit, and get away from the drugs.
Yeah. Tell me about the politics of something like the test strips. I mean, I think I can understand both sides of the argument. If you're giving them test strips, then it's almost like, you're saying, we know you're going to do it, and so here's something to do it better with. But
Right.
on the other side, it's also saying, well, we know you're going to do it. Please be safe. And I don't think that you want to be taking this, so here's a test strip to make sure. So what's the political fight there?
Well, I think it's just that. I think, we do want to be tough on drugs. We want to do everything we can to get drugs off the street and drugs out of the hands of people who are abusing them, and certainly our young people. And so I think, we want to be careful that we're not doing something that makes a person feel more comfortable taking a dangerous drug or an illegal drug. But I sort of compare it, and this may not be a great comparison, but I sort of compare it to, the birth control argument. If you provide birth control to a young girl, are you encouraging her, to experience behaviors that maybe she wouldn't if she didn't have it? And same with the test strips. If you give a test strip to a person so they can feel confident that the drug that they are taking is not going to kill them that night, then are you giving them, at least in their mind, some comfort in taking illegal drugs? And so I get it, but again, I don't think we can really address their drug problem if they're dead. It's hard to address the drug problem. Yeah, although I guess that takes care of the drug problem, but that's not what we want to see happen.
Yeah, of course. We certainly want Texans alive, and I think that's I mean, I haven't thought about it deeply, but I think it's a fair comparison. The birth control. I mean, I think the thrust of it is that if you're removing the risk, then people don't think about the risk, and they're more likely to act on it. And I think with drugs, it may be the same thing. But you're right. We need to. I think as Texans, we would probably want people to survive and overcome their addictions rather than, what we see on the streets today.
Yeah, I think many times, and I'm guilty of this, we want to pretend the problem is not there.
Sure.
We live in Texas. Texas is great. Texas is, Texas is Texas. And we sometimes it's a little more difficult, I think, for us to admit that we have some struggles in some areas. And so I think we have to admit that we have a drug problem, and we have to do everything we can, and we have to admit that we have people, taking a drug that they think is just going to give them a buzz or give them a little high, and it kills them.
Yeah.
And so I think my opinion is we need to be doing everything we can to keep that person alive and keep all Texans from taking something that is going to lead to almost instant death.
Yeah, I would think that most Texans would agree with that.
Sure.
So speaking of drugs, in this second special session, there's HB6, which you're the author of, which relates to hemp-derived. I mean, does it relate to hemp-derived THC? Certainly, it does. So this has been a big fight ever since the beginning. Started really in full throttle in January. With SB3 in the regular session, and then the first special session, and now the second special session, and you being the chair of the House Committee on Human Health, I would love to talk to you about HB6 and the hemp-derived THC.
Yeah, this is something that probably, had it not been for redistricting, would have been one of the headline pieces of legislation.
Redistricting definitely took the auction out of the room.
It did, and I'm okay with that as chair of public health. I'm fine with that. But that has given us an opportunity to step back and really look at and study and try to find the best path forward. And that's been very difficult. And I'll have to say we're not there yet. I filed House Bill 6. It was House Bill 5 in the first special, House Bill 6 in the second special, and it's basically a mirror of the Senate bill that's the full ban. I filed that mainly. We started there because that's kind of where we ended in the regular session. The House passed a full ban. We had the regulatory bill. Chairman King had the regulatory bill on the floor. It was amended by the Oliverson Amendment that turned it into a full ban. And so, since that is where the House ended, I felt like that was where we should start in the special. And so that's what we've done. We had a robust hearing a couple of weeks ago, and I don't know, lasted 11 hours, I think. Heard a lot of really good testimony. And I was really proud of our committee because I felt like we got feedback that said, we really listened, and we did. We are looking for the right policy for Texas. And there's a lot of disagreement on what that might be.
Yeah, for sure. So, I can understand the logic behind this is where we stopped in the first special session. Let's begin there in the second special session. It sounds like what you're saying is that you're, and I think you actually explicitly said this, you're not quite there yet. You're just introducing this as a starting point, and let's either build or whittle down from there. Is that correct?
That's correct. It's no secret. The lieutenant governor and the governor are in different places on this policy, and so it kind of puts the House in a position. It's a little bit of a challenging position. Can we pass something that can pass the Senate and that can also be signed by the governor?
Yeah, and
that's what we're looking for. We're looking for that sweet spot of policy that meets what the Senate has in mind, and they have made it very clear that a full ban is where they are, and that's what they want. The governor vetoed that. He made it very clear that that's not acceptable.
Yeah.
So it's just a matter of working. And this is not something unusual to have these. To have to work for good policy. I think good policy comes from work. And we'll continue to work, and we'll find that spot.
Yeah. So I guess at the if it starts off, if you're picking up where the first special session left off, it eliminates all THC products, and then only CBD and CBG are allowed. I've talked to. Obviously, there's a lot of people online, a lot of people that are going to testimony and saying that that's not what they want. I've talked to veterans, police officers, and there's a lot of pushback on that idea that they still want that that hemp-derived THC product available to them for a variety of different reasons. Do you is that sort? Are you where does it stand today? Is there progress towards that? I know you're saying the Senate wants that full ban, but what is the House wanting? What direction is the House going?
And to be honest with you, that's the challenge. We're trying to find what we can get out, what I can get out of committee, and what we can get off the House floor. Because we do know that there are a lot of people who are not in favor of the full ban, who want to see the synthetics banned. The bad parts of the THC.
Sure.
Want that banned. They want the age gating. Want packaging, safe packaging and packaging that doesn't, draw children to it. Those kinds of things. I think there are a lot of areas we can all agree on.
Yeah.
But when it comes down to the Delta 9, the non-synthetic Delta 9 THC that is, some would say is safe, and you can test for it and you can know what's in your product, and so. There are a number of people who say, we need that.
Yeah.
And so, again, how we get there, I'm not sure yet. That's what we're working on, but that's the challenge.
Yeah, no, I can appreciate I can tell that you're thinking about it deeply, and you're trying to find that nice balance and working hard to find the good policy. The most common pushback, I know the argument for banning because I've lived with it my entire life, right? It's never been legal until, I guess, what was it, 2019?
Right.
And I didn't even realize that it was going to be legal. All of a sudden, I'm in a shop, and what you're selling THC? That's interesting. But the argument against it oftentimes is, alcohol is legal, right? And kids get alcohol and drunk driving and, talking to police officers, most often if there's a substance that's involved with some sort of domestic abuse or violent action, usually it's alcohol, right? But alcohol's not being alcohol's not up there being proposed as a ban. And they say, well, why don't we just treat it like alcohol? Why do you think that would be, why do you think there'd be pushback for that?
Well, and that is something that there's a pretty good crowd of people out there who would advocate for that. Let's just treat it like alcohol. Have to be 21 and over to buy it. It's tested. You know what's in it. Limited amounts, taxed. Tax revenue to provide for the enforcement. And testing. The labs and. So there's a good number of people out there that would advocate for that, and we're looking at that.
Sure.
I mean, we do have. I think we do have a model in the alcohol industry of how you can have something that I think everyone would agree has the potential to be very damaging to a person, and very dangerous, and has the ability to be abused, and so and yet we're able to regulate it and have an enforcement process in place for those who do abuse it and who break the law. And so there are those who would say, well, why can we not do that with THC with again what we consider to be the safe THC, the Delta 9, that's not synthetic. And so, again, that's something we're looking at. We heard a lot of testimony to that during the hearing. But then we also heard testimony of parents of children who are forever changed because of their experiences with THC. They have become psychotic and having these psychotic episodes. And so certainly we want to be cognizant of that as we think about our policy, and we want to do everything we can to prevent that from happening. So, again, it's just a tough issue. There are people very passionate on both sides of this issue.
That's probably what makes it the most difficult.
It is. It is because of the passion that people bring to it. And, there are people who say it'll kill you. There are people who say it'll save you, And so, what do you do?
I do not envy the position you're in, to be quite honest. Another part of this that I think is interesting, there's a retailer, the retailers that sell, I guess even if it's just CBD, as it's written now, CBD and CBG have to register and pay an annual fee. And I wonder if that's, I think it's $20,000. I wonder if that's, why is there an annual fee now for anybody that sells CBD, CBG?
I don't believe so. I may be wrong on that.
Sure.
But I don't believe there is. But
I also don't think there is.
That's one of the things that has been suggested and we've looked at is a licensure structure that has to be renewed. You buy a license to be a manufacturer. You buy a license to be a retailer. And again, you have to renew that, and that and the taxes on the THC, those are certainly would generate a significant amount of revenue that could be used for the enforcement and for local law enforcement, their efforts to enforce. And so, it's an opportunity. Some would say it's an opportunity to have the industry pay for the regulation that we're going to require on it.
Yeah. So in this case, the $20,000, I think that makes sense for THC. But in this case, as it's written, I think it's just CBD, CBG. What is the fee, whatever it ends up being, whether it's $1 or $20,000, doesn't matter. What does that money go towards now if or what would that money go towards if the THC is banned, if this passes as is?
Well, I would think that I don't think it's prescribed in the bill. I don't remember the.
Perhaps I'm mistaken.
Well, I may be. Again, we've been working away from that is the base, but working away from it. I guess is how I would describe it.
Sure. Yeah, you described that at the beginning. You're picking up where you left off and either building or whittling from there. Yeah.
And I know there have been some proposals that actually prescribe how the revenue that comes from the licensure and from the taxes, would be used, and dedicating it to these different pots that are probably necessary because of having THC or CBD or whatever on the market or in the in the population. So I'm thinking that probably whatever passes, if we pass something short of a ban, and even the ban does allow for CBD and CBG, that any revenue that comes from any of those products would be directed back into again enforcing whatever law it is we pass.
Yeah. I think that makes sense for sure. And I mean, to be clear, I was a parent of 3. I didn't have access to this stuff as a kid. And if my kids, my oldest is only 10, but surely he's just around the corner from being exposed to this stuff on a more regular basis. And, I can certainly appreciate the effort in protecting, access to that, for sure.
I think it'd be hard to find a Texan who would disagree with the need to keep it out of the hands of kids. That it shouldn't be, shouldn't be packaged in a way that looks like Skittles or whatever.
Tony the Tiger.
Exactly. So I think in that area we can get pretty much full agreement. That we need to do that.
I've never met someone that wants kids to have it. Where I think everyone's agree with that. Yeah. So as we wrap up here, the special session, I think it's 2 weeks old at this point, or maybe a week and a half. Last 30 days. I don't know. I would be maybe asking an unfair question if I was going to ask you to predict if there's going to be a third. We'll see how that goes. But after the special sessions are done, before the 90th Texas legislature, there's also interim work that happens with committees and everything. And you're being the chair of the Human Health Committee, House Committee on Human Health. Is there anything that you expect to happen in the interim?
Well, we definitely will be having some interim studies. I think we're certainly going to be continue to look at, the cost of health care and availability of health care to Texans everywhere, particularly in rural Texas. And, depending on what we do with THC, I could envision us having some interim work to do on that.
Yeah.
And, possibly even, we mentioned opioids and the fact that it has kind of been relegated to the back page in recent years. Maybe take a look at where we are with that. And there are several, kind of hot button items. The MAHA, the Make America Healthy Again.
Yeah.
There's a lot of energy behind that right now. And so what does that look like, and how can we bring that to Texas? And by the way, Chair Hulls we passed a bill this last session that I think is really good, a great starting point, and really a robust starting point on moving the ball on making Texans healthier. And so we're going to be looking at that again. I've learned. I served my first 4 terms. I served on the Public Education Committee.
Yeah.
Now I'm chairing the Public Health Committee, and I've learned that both public committees, there are a lot of issues and a lot of people who are very passionate about education and healthcare in the state of Texas.
Yeah, that's for sure. Absolutely. That just reminded me. I think this is interesting. I don't know if you have much to say on it, and if you don't, that's okay. I think Governor Abbott added over-the-counter ivermectin to the special session, which I think falls into the Make Texans Healthy Again, MAHA, movement, let's say. I don't really know where that stands as of today. Do you?
So we passed that out of our committee yesterday.
Okay, cool.
Over-the-counter ivermectin sales. And so we'll see when and if it makes it to the House floor. I expect it will, but in the next few days. But yes, we passed that out of our committee. We heard it on Friday of last week, and then voted it out yesterday. So we'll see. From all indications, it's a safe drug.
Yeah.
And so I guess there's probably no reason for people not to have access to it.
Yeah, over the counter. I mean, for sure. And always, people, whatever, if they need to talk to the doctor about it, they can.
Right.
Absolutely.
Well, and to be clear, what we pass, we say over the counter, but it's actually behind the counter. And so, it's not out on the shelf where a 10-year-old can grab some of it.
Sure.
You have to go and ask the pharmacy.
It's not Tylenol.
Right.
Yeah.
Right. It's more Sudafed type medication that's behind the counter. The pharmacist, will provide it to you and then provide any consultation. The pharmacist will ask, do you have any questions about this?
Sure.
And you'll have an opportunity to visit with them about possible side effects or dosage rates or whatever.
Yeah, I'm sure I will refrain from making any pharmacist asking if you're a horse jokes. But I think that's a really interesting bill that's going through, and I thank you for updating me on it. Well, Representative Gary VanDeaver of House District 1, is there anything else that you wanted to touch on before we sign off?
No, I think we have pretty well covered it. It's been an exciting summer, and we'll see how fall turns out for us.
Awesome. Well, thank you so much. I really appreciate it. Is there a website or social media you wanted to plug?
No, not really. I mean,
if you have it, we'll find it. We'll put it down
exactly.
in the description below.
You can Google it and it'll lead you to it.
You're on there. Awesome. Well, thank you so much. I really appreciate you taking the time.
Thank you. Great to be here.